begin.
Hello everyone, and welcome back to my show. I'm Dr. Lot from Acupuncture is My Life, and in this episode we're going to dive back into the similarities and differences between the flu virus and the coronavirus. Then we'll take a look at how COVID-19 can be viewed as a warm disease in Chinese medicine. Now, after my last episode, the Acupuncture is My Life chat blew up with tons of questions regarding acupuncture, the flu, COVID-19, and how someone can resort to acupuncture to strengthen their immune system. Now, if you're interested in engaging in chat sessions to discuss acupuncture, Chinese herbs, plant enzymes, or learn more about acupuncture, simply go to the Google Play Store and download the Acupuncture is My Life app. Now, back to part 2 of influenza versus COVID-19. I want to get into the complications of both the flu virus, in which symptoms can range between mild to severe and can even lead to death in some cases, and the coronavirus, which also has a wide range of symptoms ranging from mild to severe as well. Now, symptoms for the coronavirus tend to appear somewhere between 2 to 14 days after exposure to the virus. Now, both viruses tend to have similar complications that can result in pneumonia, respiratory failure, fluid in the lungs, heart attack, stroke, sepsis, multiple organ failure, and worsening of pre-existing conditions, inflammation of the brain and heart, as well as secondary bacterial infections. Now, the differences are that with the coronavirus, blood clots tend to form in the arteries and veins of the heart, legs, lungs, or brain. And children tend to suffer from multi-system inflammatory syndrome. Now, another difference is there's an actual vaccine for the flu virus, whereas there isn't one to date for COVID-19. Now, most people who become infected with the flu virus tend to recover in a few days to less than 2 weeks, whereas when it comes to the coronavirus, the jury is still out on a recovery period, to my knowledge. Now, emergency warning signs of the flu virus in children can be trouble breathing, chest pain, bluish lips, pulling sensation of the ribs as they breathe, muscle pain, dehydration, and fever above 104 degrees Fahrenheit. Now, in adults, emergency warning signs can be shortness of breath, persistent chest pressure, and let's say in the chest and abdomen, muscle pain, seizures, dizziness, and confusion, as well as the worsening of pre-existing conditions. Now, I've done episodes on the emergency symptoms of the coronavirus, so at your earliest convenience, take a moment and view those episodes. Now, COVID-19 appears to have the ability to spread more efficiently than the flu, and the possibility exists that a person can become infected with COVID-19 by simply touching a surface or object that has the virus on it and then rubbing their eyes or touching their nose or mouth. This is why you must wash your hands as often as possible. Now, let's take a look at a possible way in which COVID-19 can be diagnosed from a Chinese medicine perspective. Now, as a warm disease, COVID-19 can be diagnosed as an exterior pathogenic evil lodging in the triple burner. This exterior pathogenic evil can obstruct the qi axis, restrain yang, and obstruct the transformation and transportation of qi, creating a toxic, damp internal environment. Let me try and define warm disease as best as I can in a way in which you can understand clearly. Basically, warm disease can be considered an exterior pathogenic factor that exceeds the definition of wind as a pathogen in Chinese medicine. Warm disease is considered extremely virulent, allowing for individuals to fall ill, irregardless of how strong that person's qi may be. Now, warm pathogenic factors can also be so infectious, entire states, provinces, and even countries can fall ill to it. Characteristics of warm disease are they can present, as I've stated in other coronavirus episodes, as well as in part 1 of this series, as a wind heat disorder in its early stages, where there's always a fever and it's highly infectious. It penetrates through the mouth, nose, and eyes. COVID-19 can be classified as a wind heat warm disease, whereas influenza cannot. Now, I've noticed in some of my COVID-19 telehealth sessions that dampness played a major role in this pathology. Patients presented with greasy tongue coatings, there was fatigue, patients stated their stools were loose and greasy, and some had presented with loss of taste, which let me know right away that stomach chi was affected. Now, fluid metabolism throughout the body having been disrupted, damaging the functions of the Sanjiao channel, allowing for this virus to affect various organs throughout the body. Now, I would diagnose my patients in accordance to the theory of the 4 levels based on invasion of wind heat. Now, one presented with symptoms of wind heat at the defensive chi level, where there was aversion to cold, fever with shivering, slight sweating, runny nose with a yellow discharge, body aches, headache, dry cough, sore throat, slight thirst with dark urine. His tongue appeared like slightly red on the sides and in the front as well. So I knew I had to release the exterior, expel wind, and restore the diffusing and descending functions of lung qi. Now, because this session was conducted via telehealth, I simply recommended an herbal formula that would release the exterior and expel wind, and had instructed him to inform his physician of the herbs in which I recommended, because I didn't want to interfere with whatever pharmaceutical regimen his physician may have him on or may want to put him on. Now, if I'd seen this patient in person instead of, let's say, via telehealth, if his pulse had presented with like a floating and wrapping course to it, I would have considered possibly needling points on the large intestine and Sanjiao channels to expel wind heat. I would have considered possibly needling points on the bladder channel to release the exterior and expel wind, stimulate the dispersing and distending functions of lung qi to stop the cough as well. I also would have considered possibly bleeding a point on the lung channel to soothe the throat, as well as having possibly needle points on both the gallbladder channel and the governing vessel to expel wind and relieve him of his headache. I'd instructed that he keep his primary care physician informed as to his overall well-being, as well as any continued recommendations made by myself. And for those who may be unaware, you can simply download the Acupuncture is My Life app at the Google Play Store to gain access to telehealth from Acupuncture is My Life. Now, don't forget to subscribe to this channel to learn more about how acupuncture may be of benefit to you, and you can also visit my website at acupunctureismylife.com and click on Understanding Acupuncture to learn more about acupuncture as well. And until next time, acupuncture is my life. What's yours?